Good afternoon, everybody, and thank you for inviting us to say a few words and a little bit update about the NORHED program. I know that many of you already are familiar with the program, and some of you are even involved directly in some of the projects that were awarded support. However, I want to say just a few words in the beginning also to summarize what the program is about before I give a little bit updates. And is it the green button here? Yes. This one, probably. So the NORHED program, it stands for Norwegian Program for Capacity Building in Higher Education and Research for Development. And the program was established in 2012. It was launched. First we had a round of calls for seed funding, and we received a lot of interest, almost 300 applications, and 97 projects were given seed funding. And then we had a call for the main call, and we received 176 applications, and 46 projects were awarded support. This program, it's replacing the previous NOMA and NUFU programs. And as you know, the NOMA program was mainly to establish master programs with partner countries in the south, and also provide scholarships for full cohorts. And the NUFU program you know much better than me, but I know it was about research collaboration, and also support to PhD and postdocs. The goal for the NORHED program is to strengthen the capacity of higher education institutions in low and middle income countries, and to help them and enable them to educate more and better qualified graduates, both men and women, relevant to the identified areas or the sub-programs of NORHED. And in addition to that, also that they will be able to produce more and better research conducted by the country's own researchers and relevant to the identified areas. So the NORHED program, I will try to be quick going through this. It's very important, the collaboration partnership between North and South. And in the NORHED program, we wanted to see if the partner in the South, the institution in the South, could be the main partner, the lead in the project. So we gave this opportunity because other programs earlier, it was Norwegian institution that was the lead and the agreement partner with Norad. And in most of the awarded projects, it is now the partner in the South who is the agreement partner with Norad, and then there is a partnership contract among all the partners in the project. So, so this is new. What's also maybe new is that it's connecting the education and research. And all the project has to have a component of education and a component of research, in addition to building the institutional capacity. The projects had to be demand-driven, so it should be relevant for the context of the partner countries, related to the priorities, the plans, and the strategies, both for the institutions and on the national level. And there should be institutional commitment and involvement in all projects. And there are three cross-cutting issues, which is gender equality, climate, and anti-corruption. All the projects also have a thematic and a geographical focus. And the whole program has a 5-year period, the first phase of this NORHED program. And the total amount, or the budget, is 750 million Norwegian kroner. And each project could apply for up to 18 million Norwegian kroner for this 5-year period. So that's, unfortunately, the value of Norwegian kroner went down, and now it's worth, 18 million is around $2.3 million, I think. A typical NORHED project, and also, yeah, I should say that it has a holistic approach. So it's looking at all the institutions, not only one education program or one research, but look at the whole institution, and it should also have a flexible approach. Usually there is either an in-country or regional master or PhD and PhD program. Some partners are establishing new programs, and some partners are strengthening what's already there to improve the quality of the program. And then there is PhD studies and postdoc fellowships. And we provide, or the program provide scholarships, but it should be for staff. It should be earmarked for staff, because we want to see that the capacity is built on the institution, so that it will be more sustainable. And there are, of course, joint research projects, which is with the all the partner institutions. And we see also that many times both the master students, PhD students, and the academic staff and the supervisors at the institutions are together in these research projects. It's also a possibility to strengthen the systems at the institution. So there could be funding, for example, if the institution need to improve the financial or accounting systems, or if they want to improve the quality assurance system, or it could be any kind of systems in the institution that needs to be strengthened. And also to support systems for knowledge management, information and dissemination of results. Also, it supports scientific equipment and small-scale infrastructure. And this could be a computer lab, or it could be a scientific lab, or it could be adding some equipment to a lab. It could also be infrastructure, for example, to ensure that there is equal opportunities for female students or staff to participate in the program. And the NORHED sub-programs, there are 6 sub-programs. And there is one on capacity building in South Sudan. And I don't know if you can see the figures, but this program was allocated 3 projects, or supported 3 projects. And then it's economic and democratic governance, which got 5 projects. The education program got 8 projects. Health got 11 projects. Humanities, culture, media and communication, 6 projects. And natural resource management and climate and environment, 13 projects. So as you see here, the health program is the second largest sub-program under NORHED. And then I also wanted to show you the map where the projects are taking place. And the numbers is actually how many projects this country is involved in. I'm sorry, Thailand should also be colored, because they are participating in building capacity in Myanmar. So they are involved in 1 project. So you see in Myanmar there's 1 project. South Sudan there are 2 projects. Ethiopia 3, Kenya 1, Tanzania 1, Uganda 3, Democratic Republic of Congo 1, Malawi 3, Mozambique 1, what more? Zambia 2, Zimbabwe 1, and you also see that South Africa is involved in 2 projects. And it's not because there's going to be built capacity in South Africa, but it's because they are also contributing to build capacity in the region with other partner countries. And it's KwaZulu-Natal University who are the partner there. Quickly, the thematic areas in these health projects, it's a lot on public health, including nutrition, reproductive health, entomology, epidemiology, antimicrobial stewardship, and conservancy, among others. And it's also a medical specialization and health personnel training. And there is a program for specialization of surgeons, general medical training, pediatric training, and nursing and midwifery program. And there's also 1 project on health informatics. There is 1 project on zoonotic disease management, and 1 project on occupational health and safety. And I also wanted to show you that although it's only 11 projects, there is a lot of partners in these projects. It's actually, in the health program, there are 26 partner institutions in the south, and I will come back to the Norwegian ones. But you also see that, for example, in Ethiopia, there are 7 partner institutions, and as I mentioned before, there are 3 projects in Ethiopia. So sometimes several institutions in the same country are involved in the same project. You can also see that Malawi has 3 institutions, and Uganda has 3 institutions, while many of the others have 1 institution in each country. So it's 13 countries involved and 26 institutions, higher education institutions. And the line, you can see that most of the institutions are involved only in 1 project. But there are a few that are involved in several projects, like, for example, in Malawi, the University of Malawi, involved in 3 projects, and Makerere University, also involved in 3 projects. And the Norwegian partners, it's the Norwegian University of Life Sciences. They are involved in 1 project. University of Bergen is involved in 6 projects, so they are the main partner for the health program in this round, at least. And then it's University of Oslo. They are involved in 3 projects, and the University of Tromsø in 2 projects. And then I wanted to say a little bit about the government priorities. They are not very different from the previous government, but since we started the NORHED program, we got a new government. And their overall aim for the development assistance, it's to support developing countries in their efforts to obtain lasting poverty reduction, democracy, good governance, and human rights. And the priority areas is education and health, with a strong linkage between these 2 sectors, private sector development, women and gender equality, and human rights. And this government also decided that there were too many partner countries in the development collaboration. So the number of partner countries this year was reduced from 116 to 84 countries. And they also decided that they wanted to focus on a few countries, so they chose 12 focus countries, where they could have a long-term poverty reduction engagement. And these countries were divided into 2 groups. So there's one group for developing countries with a rapid economic growth, and that includes Ethiopia, Malawi, Mozambique, Myanmar, Nepal, and Tanzania. And the other group is vulnerable states or states in conflict, and that's Afghanistan, Haiti, Mali, Palestine, Somalia, and South Sudan. I will try to be quick. In the white paper to the Parliament this year, or 2014-2015, the government says that the NORHED program is a central pillar in the development assistance for higher education and capacity building. And it must be result-oriented and effective and focus on capacity development in the partner countries to ensure sustainability and reduce development assistance dependence. So we worked very much on building up a result framework with all the partners, and that was a lot of effort, but hopefully it will work. And we managed to establish a monitoring mechanism that can monitor the results both on a program level and a project level. And we also have then annual meetings. All the partners have to deliver annual reports, narrative and financial reports, and then we organize annual meetings with the partners where we discuss the results so far, if there are any special challenges, if there are need for any changes. I mean, the program should be flexible also and take into account that a project delivered on a paper is not what's happening on the ground. So there could be things happening that needs amendment. We also feel that there is a very close collaboration and dialogue among the partners, and that there is the institutional ownership and support present at the collaborating institutions. We also see that it's needed to include not only the academics in this project, but that the administration and the leadership also have to take an active role and be part of it. There are several common challenges. In particular, we noticed that in some countries it's difficult to identify female candidates, especially for PhD and postdoc positions. But I think also that the partners have been very clever in trying to find, ways to solve this. And yeah, they are really putting a lot of effort, because it's very important that there will be equal opportunities for females and males in all parts of the projects. Yeah, we also noticed that where there have been a long-term previous collaboration between partners, like for example long-term collaboration through the NORHED program, we see that that's a very strong partnerships. So this is something really good to build on. And we also noticed that many of the coordinators in the projects actually have their PhDs from Norway. Yeah, and then we are also trying to look at possible synergies, of course, with other Norwegian initiatives. I shall try to be quick. And then all the question that everybody is waiting for, and that's new calls for application. So many people have asked me, and I wish that I could bring some better news. But at least there will be one call this year, but that will be on education. And this is because the government are putting this as a top priority, to focus on education. And I think also Villa said yesterday that the government decided to double the allocations to the education sector for the next few years. And this program will be concentrated thematically and geographically. And the call will come this year, but the projects will probably start next year. And then I just also show you the links to the webpage for the Ministry of Foreign Affairs, where you can find an overview of all the development assistance. And also the webpage for the NORHED program, where you can go in and you can find some small descriptions about every project under the NORHED. And you can find who are the collaborating partners and so on, and the goals and yeah, everything. And then the last picture I wanted to show you, because when we made these small summaries for our webpage, we got pictures from the projects. And since the topic here is about how to contribute to the women's and children's health and rights, we are really hoping that also the NORHED program can contribute to that. And the first picture here, it's from Malawi. It's a young Malawian patient able to walk again after receiving modern surgical treatment. So this is from the surgical specialist project. And the picture to the right there is a woman digging stones in search for gold in Tanzania. And this is from the Occupational Health and Safety project. I could say a lot, but I don't have the time. But it's all very, very good projects and interesting. And the third one, it's from Myanmar. It's the new generation. It's 4 beautiful young girls peeking into a window where they have meeting at the Rural Health Center in Myanmar. So I think with this, I say thank you very much.